Hey there, my name is Caroline Lohr, and I will be presenting a PowerPoint today on claims denials and the appeals process. I will start out by defining what a denied claim is, and then we'll talk about the health insurance cycle, and then we will end by talking about the different kinds of denials and how they can be resubmitted. So without further ado, let's begin. As you can see, this is the introduction to my PowerPoint. All the information that you will be seeing in the PowerPoint is from our course textbook, which is Understanding Health Insurance, A Guide to Billing and Reimbursement, and that's by Michelle Green. So, like I said, I'll begin by defining what a denied claim is. A denied claim is a claim that is rejected by payers due to different factors, and those factors can be coding errors, such as invalid codes, invalid CPT codes that are on the claim themselves. It could be missing information, such as maybe patient demographics are not fully filled in on the claim, or patient coverage issues. So maybe the policy number on there is for an expired policy. Um, so all of these things contribute to denied claims. Denied claims are unpaid claims that have been returned to the provider by clearinghouses, third-party administrators, or third-party payers. Um, so when a claim is submitted, it will go through processing and education, and then the payer will send back a remittance advice explaining the reasons that a claim has been denied. This goes to the provider. And then they'll also send out an explanation of benefits to the patient or the policyholder. And on these two forms, there will be actually just the remittance advice will have the specific reason codes, and we'll talk more about that later on in the presentation. But to continue, denied claims are considered open claims, meaning that they have not been completely processed until the appeal process for reconsideration of payment has been exhausted. So for an appeal to be submitted, there are some documents that are required. An appeal letter is something that's created and signed by the provider to explain why a claim should be redetermined. Along with an appeal letter, sometimes supporting documentation, copies of medical records are needed to prove the medical necessity of a procedure or a service that was provided to a patient. So these are the two main supporting documents that are attached to a claim for resubmission. I've provided an example to the right here. This is from our textbook. It's figure 4.9. And you can kind of see how this is a sample appeal letter. Okay, so the insurance claims cycle. Before discussing the appeals process, it's very important for us to understand the insurance claims cycle, which is made up of the following stages. There's claims submission, claims processing, claims adjudication, claims payment or claims denial, and then after that is when we make our determination about resubmitting claims with appeals for those denied claims that come back to us. So more on the insurance claim cycle, claim submission, which is the first step. it's the electronic or manual transmission of claims to payers, clearinghouses, or third-party administrators for processing. So a lot of times these, if it's electronic, it will be submitted using a medical practice management software. Um, Medicare actually enforces the mandatory submission of electronic claims. There are some exceptions under the Administrative Simplification Compliance Act, such as interruptions in electricity or communication service, small provider entities with fewer than 25 full-time employees, and dental claims. But other than that, Medicare does require the electronic submission of claims. Okay. The next step, claims processing. That is going to be the analyzing, editing, and validating of limited information about the patient and the provider. So that's going to be like insurance status, patient and provider identification numbers, and demographic data. These things are going to be verified during the processing of claims. And this process is actually done by a claims examiner. I have a note here. In electronic claims processing, the claims examiner views data on a split computer screen that contains the claim on the bottom half and information verification software on the top half. And I actually have an example of that on the next slide, but I've got one more note on this slide. So if during the analysis of the claim, there's incorrect or missing information that cannot be edited by the claims examiner, the claim is rejected and automatically returned to the provider for correction and resubmission. So it does not go on to the next step, which is adjudication. So here's that example of the split screen. So at the top, there's going to be like the insurance verification software and then the actual claim itself at the bottom. And that's from figure 4.5 in our text. So the next step in the insurance claim cycle is claims adjudication, which is a more comprehensive analysis of claims as far as like according to policy, like the health plans and the payer rules, to establish what services are covered or not covered, which ones are pre-authorized or not pre-authorized, and then also looking into medical necessity. So like I said, procedures and service codes reported on a claim that are not included on the policy's master benefit list are considered non-covered benefits and will result in denial of the claim. Procedures and services provided to a patient without pre-authorization from the payer are unauthorized procedures and services and will also result in the denial of the claim. The payer matches procedures and service codes with diagnosis codes reported to ensure medical necessity. So that's our check and balance system for making sure that they are linked together correctly. All the codes, the ICD-10s matched with the appropriate ICD PCS or the CPTs, HCPCS codes to establish medical necessity. And then we finally come to the result of our claims cycle, which is either claims payment or claims denial. So after the claim has went through processing and adjudication, the payer sends a remittance advice to the provider and then an explanation of benefits to the policyholder. And these documents have information in them about reimbursement, denial of reimbursement, and then also the patient's responsibility for payment. So that would include like a co-payment. For Medicare claims, The remittance advice is actually called the Medicare remittance advice, and the explanation of benefits is called a Medicare summary notice. So the information found on the RA remittance advice is used to make adjustments to patients' accounts. Those are for the payments that are approved. And it's also used to make corrections for denied claims or to create an appeal for a denied claim. And these things are going to be based on the CARC and the RARC codes provided. So these are our reason codes that are provided on the RA so that we can see, okay, why was this procedure or why was this service not covered? So the CARC is Claims Adjustment Reason Codes, which explains reasons for denied or rejected claims. And then the RARC are Remittance Advice Remark Codes that provide additional explanation of reasons for denied or rejected claims. So these are very important in determining what our next steps are. Can this be resubmitted? Can this be corrected and then resubmitted? Or are there no other steps we can take? Okay. So I have a list here of the main reasons for denied claims. I'll just read those off. Procedure or service not medically necessary, pre-existing condition, non-covered benefit, termination of coverage, failure to obtain pre-authorization, out-of-network provider used, lower level of care could have been provided, incorrect codes or incorrectly linked codes reported on a claim, bundled service or global period service is not eligible for separate payment, claim contained incomplete information or another insurance plan is primary. So here is our first one. Procedure or service not medically necessary. So this goes back to our linking the diagnosis with the procedures and is their medical necessity supported from documentation to the claim and by the payer. So for these, the payer has determined that the procedure performed or service rendered was not medically necessary based on information submitted on the claim. What can we do about it? So if we get this back on the remittance advice, our action plan is to review the original source document. So go back to the patient medical record and determine whether significant diagnosis codes or other important information have been clearly documented or overlooked. So we need to look back, make sure it's there. If the medical record supports medical necessity, an authorized appeal letter providing the reasons the treatment is medically necessary can be sent to the payer. If the medical record does not support medical necessity, discuss the case with the office manager and provider.